On your health tonight, and as shocking as this may sound, like we're going to talk about COVID, because it seems like everyone knows someone with COVID-19 right now. As you see, Dr. T is there tonight. Case numbers are rising not only in Massachusetts, not only in the United States, in the Olympics as well.
It's true.
So the numbers are increasing, and in our newsroom as well. We're not exempt from that, or immune from that. Dr. Todd Ellern is with us, Chief of Infectious Diseases at South Shore Health. So question one, other than saying we're still talking about COVID, let's start with the data. What are you seeing?
All right, there's this new variant. It's called KP.3.1.1. The bottom line is, COVID likes to mutate. So we're seeing increases in cases in the United States.
Yep.
In our state, in our
Yep.
hospital, we've got
Yep.
about 10 or 11 inpatients.
Yep.
Over the past month, hasn't
Yep.
really increased or decreased. It's pretty steady.
Yep.
But like you said, there's even 40 athletes at the Olympics with COVID right now. So it's surging in about 84 countries. But the good news is, while there's more cases, doesn't seem to be a more severe variant.
That's where I was going. I mean, it's not knocking you down. I've seen some people, though, honestly, people that in my age who have said, it really knocked me out for 40 hours or so.
Right. I think for the individual, it can range from asymptomatic to it can still put you in the hospital, occasionally in the intensive care unit, although that's less frequently as we have more population immunity.
We don't have to go. Do we have to? Should we go to masks and Paxlovid and the whole 9 yards, isolation again, or no?
Right. Definitely not masks for everyone.
Good, okay.
Masks still work for individuals concerned about getting it,
Yep,
right?
yep.
In closed settings. Paxlovid, absolutely, if you're at high risk and get COVID.
Got it.
But not for the standard person, not for
right.
most people.
Right.
So
we are learning to and have to live with COVID, right? So when do you think infections will drop and the number will come down?
Well, we are starting to see wastewater decrease.
Oh, okay.
So that makes us think that hopefully the peak has occurred and it's going to start to go down soon. And that's good news. But remember, what we've seen over the past 4 years is 2 peaks with COVID.
Yeah.
The classic winter peak that we see with respiratory viruses like the flu,
right.
but also a summer peak, which is what's unique to COVID. Let's face the facts. COVID has not taken a break this summer. And it's just shown that it can spread in more than one season, which is unique for respiratory viruses.
I can't believe all these years we're still talking about COVID, but obviously we have to learn to live with it. Do we have to talk about vaccines again?
I think especially for the people that are at high risk,
right.
Chronic lung, heart, kidney, diabetes, immunocompromised, those patients absolutely not only need to get it once a year,
right.
but the CDC is even recommending it twice a year.
Yes.
And generally speaking, if you get COVID, we usually say you want to wait about 3 to 4 months before you get your next vaccine. If you've gotten your vaccine, again, you want to wait at least 4 months.
So this is how you're advising your patients? This is what you're telling your patients to do?
That's right.
Especially if you're in that risk category area,
yeah,
right?
I mean, if you're standard risk, if you're healthy,
right.
if you're young,
right.
I get the fact if we know that a lot of people
right.
aren't getting their boosters.
Right.
But I do think that for the highest risk people, it's still something, even if it doesn't prevent COVID, it prevents severe illness. And that's one of the
right.
reasons
right.
that we're not seeing significant increases in hospitalization.
And I'm not surprised, but even touching the Olympic population over in Paris.
What do we have? We have congregate
Exactly,
setting, right?
exactly. All those people in one
And it's
area.
not that we're seeing increase in severe illness,
right.
but we expect this.
Right.
It's
right.
happening in Europe just like it's happening in the US.
Dr. T, thanks for your insight. Great to see you, Marie.